This is the Lucas County Children's Services 2019 Report to the Community. Child abuse remains a major problem in Lucas County. In 2019, there were more than 5,100 reports of abuse or neglect. That's up 12% from the year before and up 14% from 2015.
In 2019, Lucas County Children's Services saw 4% more referrals that involved physical abuse of a child. We believe it has to do with dramatic increases in the number of babies exposed to THC or other substances and more domestic violence. The number of referrals from medical professionals increased by 2/3, and referrals from law enforcement increased by nearly half. More than 7,700 Lucas County children were alleged to have suffered abuse or neglect in 2019. That's 11% more than in 2018 and 14% more than in 2015. Our investigations revealed that 2,479 children were indeed abused. That is a year-to-year increase of 34% and up 131% since 2015.
For every 1,000 children in the 43604 zip code, we received a referral on 169 of them. Other zip codes with the highest rates of referrals include 43608, 05, 09, and 10. We saw the greatest increases in the number of referrals in 43623, 43607, 10, 13, and 14. 14% of all cases opened in the 43605 zip code. That zip code, along with 43609 and 43612, had the most cases opened due to substance abuse. 57% of the new cases we opened involved parents using drugs, followed by domestic violence and mental health issues. When drugs were a factor with the family, 43% of the time the parents were using opiates, followed closely by marijuana, cocaine, or crack. Opiate use was down slightly from the previous year, but remains a serious problem.
Lucas County Children's Services served more than 13,000 children and nearly 6,500 families last year. That's 13 out of every 100 children in the county and 12 of every 100 families. The good news is that LCCS is helping more families while children remain at home. Back in 2016, only 38% of cases involved children who could stay in their parents' custody while receiving services. In 2019, that increased to 63%. More than half the children in custody are babies and toddlers, and slightly more than half of them are boys. Keeping children with their birth families has had a positive effect on agency finances. In 2018, it cost LCCS nearly $13 million to keep children in foster care. That's a quarter of the agency's budget. In 2019, placement costs dropped by more than $1 million just by working more closely with families to care for their own children. We still work with about 250 foster caregivers, and we need more people to become foster parents.
While 20% of Lucas County's population is African American, Black children make up more than 40% of children on referrals and in open cases. Our agency is working to identify the factors that lead to disproportionality and the ways to overcome them. We continued our practice of connecting parents and children with services. Our goal is to help them overcome trauma and deal with the problems that make it unsafe for children to live at home.
Lots of good things happened in 2019. Caseworkers completed more than 99% of their scheduled visits to children. Caseworkers also made nearly 99% of visits to adults on cases. We completed more than 7,300 family visits. That's an average of 23 visits each day. And our drivers made 6,800 trips, delivering or returning more than 9,000 children from visits with their birth families. And with help from the community, we welcomed more than 2,500 visitors to our annual Trunk or Treat. 900 children on our caseload received filled backpacks for the new school year. And we brightened the holiday with some of the 18,000 toys and gifts you donated to our annual holiday gift drive.
2020 arrived with an unexpected set of challenges. No one could have anticipated the COVID-19 pandemic. It pushed us to find new ways to fulfill our mission to protect children. By combining traditional face-to-face visits and teleworking, caseworkers were able to see children and families and ensure their safety. At the same time, the agency continued preparations for the Family First Preventive Services Act, Ohio START, and a number of other nationwide child welfare practice changes, all of which feed into our agency's strategic plan. Safely reducing the number of children in care by 75%, developing cultural competence to reduce disproportionality, leveraging strategic collaborations, making best practice improvements to ensure quality service delivery, establishing a Parent and Kin Training Institute. Watch this space as Lucas County Children's Services forges ahead, leading the community in the protection of children.